Hi everyone, my name is Casey. Today I'll be presenting to you about poliomyelitis. Poliomyelitis is also known as polio. Polio in Greek means gray. Myelitis is inflammation of the spinal cord. Therefore, poliomyelitis is inflammation of the spinal cord and/or gray matter. The poliovirus is an enterovirus which invades the intestines of the human body, causing nerve and spinal injury. The poliovirus belongs to the genus Enterovirus, and the family is picornavirus. The size of the virus is very small, it's 30 nanometers. The stereotypes are poliovirus 1, which is the most virulent and common, and the other two is poliovirus 2 and poliovirus 3. Polio symptoms are contagious viral illnesses that in its most severe form causes nerve injury leading to paralysis, difficulty breathing, and sometimes death. 95% of all polio cases are asymptomatic, meaning they do not experience any symptoms. The rest of the 5% can be divided into three types. This includes abortive polio, non-paralytic polio, and paralytic polio. There are three types of polio. The first is the abortive polio. Now, this is when a person will experience the viral-like symptoms, and these symptoms include fatigue, fever, vomiting, nausea, headache, and a sore throat. Now, the second type is the non-paralytic polio, and this is when a person will experience the abortive polio symptoms mixed with the neurological symptoms. And then the third is the paralytic polio, which is less than 1%. And usually people will experience deformation of limbs, specifically ankles, feet, and/or hips, sudden temporary or permanent paralysis, muscle pain and spasms, floppy limbs on one or both sides of the body, loss of reflexes, and/or muscle ache and weakness. The first appearance of polio was in the US in an outbreak in Vermont in the summer of 1894, and this was a summertime epidemic. And during this time, many adolescents and young adults were affected. There was a great increase in paralytic cases and also an increase in the mortality rate. And many died as their respiratory muscles were paralyzed, and thousands of infants and youths were left with their extremities permanently crippled. In the 1930s, the development of the iron lung helped polio victims with paralyzed respiratory systems. And this machine was a pressure ventilator that helped a person to breathe on his or her own in a normal manner when their muscle control was lost or their control was weak. And this helped them to breathe. So humans are the reservoirs for the polio virus, and the virus actually resides in an infected person's throat and intestines. Humans are the only known carriers of polio, and actually 90 to 95% of polio carriers are asymptomatic, and those infected may spread the disease for up to 4 to 6 weeks. The poliovirus is transmitted through two different routes, the first being the fecal-oral route. This is the primary mode of transmission through ingestion of food or water contaminated with feces containing the virus. The second is the oral-oral route. This is transmission through contact with infected respiratory secretions, mucus, or saliva. The poliovirus enters the human body through the nose or mouth, leading to the throat, intestines, and respiratory tract. So the polio virus enters the human body through its virulence factors. Now, this is when the polio virus attaches to a plasma membrane protein, and then this genome is then released into the cytoplasm. And once it's released into the cytoplasm, the lymphoid tissues are targeted by the virus, allowing entry into the bloodstream. And once it's inside the cell, the poliovirus replicates thousands of copies of itself and spreads to the other cells in the body. And as this virus multiplies within the cytoplasm, the motor nerve cells die, leading to the paralysis. There are many different ways and tests to determine whether a person has the polio virus. Typically, a physician will order a specimen culture, and this is cultures from your throat or maybe stool samples that you have to give them in order for them to do the test to see if you have the virus. The next test would be the cerebrospinal fluid analysis. Now, this is collecting the spinal fluid from a spinal tap, or maybe they will do a serology testing or blood tests in order to determine if you have the polio virus in your body. Unfortunately, there is no cure for polio, although there are supportive care, which is providing relief from the symptoms depending on the severity of the type of polio that you have. So supportive care would be medications to reduce pain, breathing assistance with a mechanical ventilator, long-term rehabilitation, including occupational therapy or physical therapy. This also includes braces and or corrective shoes, and even at times orthopedic surgery. However, in addition to the supportive care, they also want to prevent complications, so preventing from the symptoms from becoming worse. This is the statistics of the polio cases in the US by year. And actually, as you can see, the cases in the 1940s to the 1950s had high skyrocketing cases of polio disease. And as you can see, the chart goes down, and from the 1960s all the way to the 2013, the polio cases have plummeted, so there are rarely any cases in the US now than there were before. There are two types of polio vaccines: the Salk vaccine, which is also known as the inactivated polio vaccine, or IPV, and the Sabin vaccine, which is also known as the oral polio vaccine, OPV or TOPV. And these are both trivalent, that is, active against all three polio virus types. However, the current recommendation is IPV. There are several different ways in preventing the polio virus. So the first being the personal habits, cleanliness and improved sanitation. So making sure to wash your hands, performing proper hand hygiene, and improving sanitation, such as making sure you wipe down countertops and that everything is clean. The second would be barriers. This includes IPV or OPV vaccinations. And the third is specific defenses. For example, adaptive immunity from the IPV and OPV vaccines, which aid in combating polio. Poliomyelitis is a serious disease that can cause severe damage, leading to nerve injury, paralysis, difficulty breathing, and even death. Everyone should care about polio as it is a contagious and even deathly disease that does not have a cure. It is important that everyone is aware of polio and the severity of the disease. Awareness and education will help eradicate the polio virus. Lastly, research and innovation organizations are important in improving studies and gaining additional knowledge to eradicate polio once and for all. Thanks for watching. I hope you all enjoyed my presentation, and if you have any questions, please feel free to ask.